If you take a pill for your cholesterol every morning, I need you to watch this video to the end. Because there is something your doctor almost certainly never told you about that pill. And it may explain something you have been noticing for a while, but could not quite name. You go to say a word, and it just is not there. You walk into a room, and stand there wondering why you went. You read the same paragraph twice and nothing sticks. You forget the name of someone you have known for years. You are in the middle of telling a story, and lose the thread completely. And every time any of this to your doctor, they said the same thing. It is normal. You are getting older. Everybody goes through this after 60. I want you to consider something. What if it is not just your age? What if the pill sitting in your medicine cabinet right now, the one you take every single morning without thinking about it, is making things worse? What if the very medication prescribed to protect your heart is quietly doing something to your brain that nobody warned you about and nobody is monitoring? I am Dr. Michael Lee. And in over 30 years working with patients in integrative and natural medicine, I have had this conversation hundreds of times. A patient comes in. They are 62, 68, 71, sharp their whole lives. Retired teachers, engineers, business owners, people who build things and raise families and never had trouble thinking. And somewhere in the last few years, something shifted. The sharpness got a little slower. The words started disappearing. The brain fog set in. And when they look back at the timeline, there is almost always a medication around the same time. Today I am going to show you three things. First, what that pill does inside your brain that your prescribing doctor almost certainly never explained. Second, the simplest thing you can add to your morning routine this week that may start giving some of that sharpness back. And third, the conversation you need to have with your doctor. Not the same conversation you have been having, a different one. One that actually looks at the full picture. And at the end of this video, I am going to tell you the one thing you absolutely must not do when you hear all of this. It sounds obvious, but people get it wrong every single time. And getting it wrong can seriously hurt them. Stay until the end. Before we begin, leave me a comment right now and tell me where you are watching from. I have people watching from the United States, Australia, the United Kingdom, Canada, and dozens of other countries. I read every single comment. And tell me this. Has your doctor ever told you that your memory problems or your brain fog are just a normal part of getting older? Write yes in the comments if that has happened to you. Because based on what I hear from viewers every single day, I suspect the answer for most of you is yes. And what I am going to share today may finally give you a better explanation than the one you were given. Now, let us talk about cholesterol and the brain. Because what I am about to tell you is something most people have never heard. And it changes the entire picture. When most people think about cholesterol, they think about clogged arteries and heart attacks. That is the story we have all been told for decades. High cholesterol is dangerous. Lower it as much as possible. Take the medication. Keep the numbers down. Protect your heart. That story is not wrong. But it is massively incomplete in a way that matters enormously, especially for anyone over 60 who is already noticing changes in their memory and mental clarity. Here is what that story leaves out. Your brain is the most cholesterol-rich organ in your entire body. 25% of all the cholesterol in your body lives in your brain. The pathways that electrical signals travel along, the faster and cleaner those pathways are, the faster and more accurately your brain thinks, speaks, and remembers. To support the tiny junction part. Your brain, the pathways that electrical signals travel along, the faster and cleaner those pathways are, the faster and more accurately your brain thinks, speaks, and remembers. To support the tiny junction part. Your brain, where one brain cell talks to another, the places where memories form and words are retrieved. Here is the critical part. Your brain makes its own cholesterol. The timeline varies depending on how long you have been on the medication and how your body responds individually. Do not give up at 3 weeks if you have not noticed anything yet. 2 months is the minimum fair trial. One thing I hear from patients often is that they tried CoQ10 before and did not notice much. The first question I always ask is, which form did you take? If it was Ubiquinol rather than Ubiquinol, the answer may simply be that your body was not converting it efficiently at your age. Switching to Ubiquinol and giving it a proper 2-month trial often produces a completely different result. I want to pause here and ask you something in the comments. Have you ever noticed any changes in your memory, your ability to find words, your mental sharpness, or your energy since you start taking your cholesterol medication? You do not need to name the medication. Just write yes or no below. And if yes, roughly how long after starting the medication did you first notice something? These responses matter to me, and they matter to the hundreds of other viewers who will read them and realize they are not alone in what they are experiencing. The second thing I want to share is about a conversation you are probably not having with your doctor. Not because your doctor is bad at their job, but because the standard checkup for people on cholesterol medication is built around one number: LDL, the bad cholesterol. The prescription gets written, the follow-up checks the LDL, the number is lower, the doctor says, good, see you in 6 months. That is the entire process for most patients, and it misses most of the real picture. There are 3 tests that give a far more complete view of what is actually happening in your cardiovascular system. I am going to give you their names, and I want you to write them down and bring them to your next appointment. You do not need to understand the science behind them. That is your doctor and APO's job. You just need to know to ask. The first is APOB. The second is LPA. The third is HSCRP. Write those 3 on a piece of paper. At your next appointment, hand the paper to your doctor and say, I would like these included in my next blood panel. A doctor who takes your health seriously will either order them or explain specifically why they are not relevant for your particular situation. That conversation about your full understanding whether your current medication and dose are actually matched to your actual risk. Some people on high doses turn out to have lower risk than their 1 number suggested. Some people with apparently normal have lower risk than their 1 number suggested. Some people with apparently normal results have much higher risk than anyone caught. The full panel tells the real story. The third thing. Many people do not know that natural options exist that have been studied in real clinical trials for cholesterol management. Not supplement company marketing, actual published research. I want to tell you about 3 of them. These are not suitable replacements for everyone, but for people with borderline cholesterol, for people who have stopped their medication because of side effects and need something to discuss with their doctor, or for people who want to reduce their dose under medical supervision, these are legitimate options worth knowing about. The first is an extract from a citrus fruit called bergamot. Not the flavor you know from tea, a concentrated supplement form that has been studied specifically for its effects on cholesterol levels. Multiple clinical trials have shown it lowers bad cholesterol and raises good cholesterol. What makes it particularly relevant to our conversation today is that it works through a completely different process than the standard cholesterol medication, meaning it does not affect the same energy production that those medications interfere with. For people who have experienced cognitive symptoms, it is one of the more interesting options to discuss with their doctor. The second is something called berberine. It comes from the roots of certain plants that have been used in traditional medicine for centuries. And over the past 2 decades, a significant body of modern research has built up around it. Studies have shown meaningful effects on both cholesterol and blood sugar. The dose studied most often is 500 milligrams, taken 2 or 3 times a day with meals. One important note, berberine interacts with several common medications, including blood pressure and diabetes drugs. Do not add berberine without discussing it with your doctor if you take any prescription medication. That is not a general caution. It is a real interaction that needs to be managed. The third is something so simple that most people dismiss it entirely. Cholesterol, psyllium husk. The fiber powder sold at every pharmacy for just a few dollars. Research significant enough to earn an FDA health claim shows that 5 to 10 grams of psyllium husk daily lowers bad cholesterol by 5 to 8% on its own. It works by binding certain substances in your digestive system that your body would normally recycle, forcing it to use circulating cholesterol to replace them instead. No meaningful drug interactions at standard doses, and as far as your brain is concerned, completely harmless. Now, I told you at the beginning, there is one thing you absolutely must not do. And I need to tell you now, because it matters more than anything else I have not do. And I need to tell you now, because it matters more than anything else I have said today, do not stop your cholesterol medication on your own. I know that may be your first instinct after everything you have just heard. You have just learned that the medication you take every morning may be affecting your brain and contributing to the memory problems that your doctor said were just aging. The natural human response to that information is to stop taking it immediately. Please do not do that. Here's what happens when you stop suddenly. Your body has been suppressing its own cholesterol production because the medication was doing it for you. When the medication disappears overnight, your body overcorrects. Cholesterol production surges. Your bad cholesterol can spike to levels higher than where it was before you ever started the medication. In people who have existing heart disease or significant risk factors, that spike is on. Stopping that creates its own risks. The right move is to take what you have learned today and use it to have a better appointment with your doctor. Bring the list of 3 tests. Ask about CoQ10 with your doctor. Bring the list of 3 tests. Ask about CoQ10s and tell your doctor you would like to add it. Ask whether your dose is still appropriate given your current health profile. Ask whether the specific type of medication you are is the one that stays out of the brain most effectively. These are all completely legitimate questions. You are not going against your doctor by asking them. You are giving your doctor more to work with. And you are finally getting the full conversation you should have had years ago. Here is what I want you to take away today. The brain fog and word-finding problems many people over 60 experience after years on cholesterol medication are not inevitable aging. There is a real documented connection between these medications and a drop in the fuel your brain cells run on. CoQ10s in ubiquinol form, 100 to 300 milligrams daily with food for at least 2 months is the most direct first step. The 3 blood tests worth asking your doctor for are APOB, LPA, and HSCRP. Natural options including bergamot extract, berberine, and psyllium husk have real clinical evidence and are worth discussing. And stopping your medication suddenly without your doctor and APOs as guidance is dangerous and must not be done. Now I want to hear from you. Are you going to ask your doctor about CoQ10 at your next appointment? Are you going to bring that list of 3 tests? Leave your answer in the comments below. And if this video gave you information that your doctor has never once mentioned in all your years of appointments, which I believe it has,